Primary exertional headache, that is the topic. There are so many causes for headache and so many diseases which are related with headache. I can list at least 50 of them, at least. So, today's topic is primary exertional headache, this being one of the causes for headache. This is usually seen in young generation and the cause being exertion. That is, they don't know the limit of work and they overexert. For them, this is overexertion, and whenever they overexert, that time they have headache. So usually it is seen in the age of 20 to 35 to 40, say between 20 and 40. And if you ask the patient during the time of exertion, let it be at home or office or maybe in the gym or whichever your workplace is, at that particular time when you get headache, is that temperature, local temperature more? The answer is going to be yes. And humidity also, it can increase primary exertional headache. Now, if you ask the patient, do you have a family history of, do you have migraine or do you have a family history of migraine? Sometimes we get an answer yes, because even that can increase the chance of getting primary exertional headache. Now, what is the reason for this? Whenever the person exerts more than his limit, what happens is there will be dilation of the blood vessels, that is mainly in the head. This will result in headache. So every person, he should be able to know the limit of his exertion. So when you ask the patient, his main complaint is going to be that I get headache whenever I exert, but he may or may not know his limit. So as a ENT doctor, first we have to rule out whether he has got any ENT related problem or not. So usually when we do an ENT examination, it is going to be normal. So like what I have told you in the beginning, there are so many different causes, and the patient is also anxious to know whether he has got any serious problem or not, or is it simple primary exertional headache. So from the ENT point of view, we have to see whether he has got sinusitis or migraine or any myofascial pain related to that or not. And of course, we have to check vitals, whether he has got blood pressure, which is usually uncommon in that age group, between 20 to 40 years. It's uncommon. So, examination is normal, and nasal endoscopy is also normal. And when you do a simple blood test, hemoglobin is going to be normal, and TSH usually also is normal. Some of the patients, they used to compel us to get a CT scan. Doctor, we would like to get a CT scan of the brain to be done. Usually, even if you do CT scan or MRI, it is going to turn out to be normal. It's going to be a typical history that whenever the patient exerts more than his limit, he will get headache. So it's more of a clinical diagnosis. We are just doing all the investigation to rule out other red flag problems of other diseases. Now, treatment. Treatment is very simple. Whenever he gets a headache, at that time he has to take rest. And if he can apply ice locally, far and good, well and good. And at the same time, even with rest, suppose it doesn't decrease, you can take paracetamol, Dolo, Calpol, simple analgesic painkillers. Indomethacin, it's a good drug for this, but usually you cannot repeat this drug because it has got so many side effects. Now, prevention is better than cure. So the person, he should be knowing his limit. So suppose he says, I get headache after working for 2 hours. In that case, we have to advise him, please, you take rest, say after working for 1.5 hours, take rest for 5 to 10 minutes. And in between your work, you try to be hydrated. You drink as much as water as possible. And the whole day, try to replace electrolytes also. Lemon juice with salt and water. So all this is going to help him. And suppose he has got migraine, we have to treat migraine too. Now, those patients who get headache when they go to gymnasium, for them the advice is going to be, you should not start off your gymnastic exercise immediately. You need a little warm up, at least 5 to 10 minutes. And you should know your limit. and you should, before say about like what I told you, if it is 2 hours, you have to stop your exercise by 1.5 hours, take rest for some time or lesser exercise for some time, and then you restart the exercise. So that is how we manage primary exertional headache. Thank you so much.